Welcome to Perspectives with Asma Silva. Again, we have a very interesting show and a very interesting guest. We have covered the topic on the Middle East in many forms. We've had Jewish Voice for Peace as guests. We've had people who've talked about the Israeli-Palestinian issue. But today we're going to have Bill Slaughter, who is going to talk to us about his work in the Middle East. He's a volunteer. He's in healthcare in the Boston area. And he joins us today to share his perspective on his work with the Middle Eastern issues. So thank you today for joining us. And I know we have connected several times over the last several months on different reasons and different organizations. But this is a topic that I know you are very passionate about. So I'm going to give the floor to you to start the conversation and let you drive what issues that you're interested in, what motivates you, what you have found in your experiences, and share some of your personal stories through this journey of trying to help in that area.
Okay, thanks, Asma. And it will bridge to other times that we've talked here in the U.S. So I work in mental health and healthcare, and for a long time have kind of bridged working here primarily in the U.S. with doing some volunteer work in the Eastern Mediterranean area, kind of focused on Israel, Palestine, and then just immediately outside. We're going to insert a slide one slide that'll have a few pictures of folks in camps, and another one that has a map of the region. You may be seeing that right now as I'm speaking, I'm not sure. Since the 1940s, the big demographic shift or takeover of Palestine then, Palestinian folks have lived largely in refugee camps, a large number of them, in Israel, Palestine itself, and then immediately outside in the countries of Jordan, Syria, and Lebanon. So the map shows I call it an archipelago of camps, just dozens out there, about 60 main camps and many smaller ones not on the map. So I go to different areas there, and I don't have good Arabic, so I don't do patient work directly, but do trainings in English with colleagues there, and basically some camaraderie and support of people there. And then secondarily, whenever I have extra time, a little bit before or after, meet with other good folks who are doing work in more of a general social sense, like cross ethnic lines there, Palestinian and Jewish folks, and so on. So try to have a real broad view of the area there. Yeah. The initial instruction or orientation I had a long time ago in the 1970s, first learning about the area, I happened to, through interest in language, fall into friendship with groups of Palestinian and Israeli Jewish folks who were getting along just fine. And that was kind of my first introduction as a general American, not knowing much about the area other than general American culture. But that initial kind of orientation that folks there who are good-hearted and believe in equality and want to get along together can do that. And that's kind of stayed with me. So I seek out folks like that and hope to help out a little bit and so on. Yeah.
So would you like to tell us a little bit about your work? I know you have a lot of information and a lot of experience visiting that area. If you'd like to share some of your experiences.
Well, I always say, first of all, that I see myself as an intermediate knowledgeable person. Of course, the best people who really know are folks who live there, have grown up there, and just have full life experiences there. So, of course, I never mean to speak for people in that position, and in fact do a lot of work to support especially healthcare colleagues from that area when they come to the U.S. and for them to give their story and do tours around the U.S. and so on. So that's always the first thing. But I do believe that there's a role for I think sometimes general Americans without strong ties in that area to kind of ask what's our position, how can we help bridge and so on. So working in healthcare, I work in the Boston area in mental health field. That's my primary income. This is all kind of on the side. But when I'm over in that area, I'm doing trainings with staff there, particularly in the Gaza Strip part of Palestine, Israel, and then sometimes in Jordan and Lebanon as well. you can imagine that the main training topics have to do with trauma,
Yes.
depression, anxiety, and so on. Suicidality is a rising issue there, unfortunately. And of course, it's always kind of cross-cultural work. You know, I'm not an outside expert coming to, you know, bless people with my great knowledge. I share what I've learned and my experiences, and then always in dialogue and kind of learning from others there too. To me, one of the most interesting and meaningful examples is actually the most requested training in Gaza so far has been on what to do with people overall, and especially kids, who have entrenched nightmares. It's the same nightmare or similar theme nightmares coming back again and again and again, and what do you do?
Right.
So there's particular techniques, has to do with kind of learning what the storyline is from a child in a safe situation, sometimes drawing that out. Art therapy can be helpful, especially with kids. And then intentionally changing the storyline to be a better one, to what do I really want to come out of that trauma narrative that's so deeply entrenched. When I first did that several years ago, I was real excited that one of the psychologists in the community mental health center there, that I was, you know, kind of cross-training with and so on, you know, kind of said, well, we've been doing real similar things here, and you know, he explained to me that in Islam, there's some sunnah about preparing to go to bed with cleansing oneself in the bedroom and so on, and turning and making shaitan go away and so on. And so we talked about similarities in those techniques and kind of mixed things up there, depending on people's individual and family kind of how observant people were and so on. So a lot of interesting crosswork there. Some examples.
So what you were saying caught my attention is the fact of child growing, you know, having repetitive nightmares. We think of trauma, but when most of us are thinking of trauma, we're thinking of just violent acts. Some of us sometimes forget that after these violent acts, or observing or witnessing these acts, there's a lot of emotional and mental trauma that especially for children, that are long lasting. How do you do that? How do you bring yourself to speak to a child? And I mean, as a human, how are you, you know, how do you bring it home? How do you process it? And how long does it take for a child to recover for something like this?
So let's split out two things. Again, my Arabic is poor. I'm not doing clinical work in Arabic. I do similar work here in the US. So I can kind of talk generally and then apply in that situation. You know, as far as the common question of how do you, healthcare giver, especially in psychology and mental health, hear so many stories in that. It's a real individualized question. I'll just say that in my training, which is root training was in a Buddhist school, a lot of kind of meditation and you could say spiritual-based kind of practices on kind of letting go, being quite present in the moment, but also not continuing to take on narratives, just coming back to nowness, if you will.
Okay.
So that's a quick answer to that. When I'm in that area, one way I think about my colleagues there, healthcare providers there, and what I was saying about that, about not carrying too much of a burden, we humans can't be totally perfect in that, so sometimes carrying some burden home in that. But that's working in, you know, in the U.S. Obviously, we have big levels of trauma here, but you know, relatively a little less than in parts of the Middle East there. So I'm able to do that more. When I'm with colleagues in the Middle East, I also often think of them, from what they're telling me, as almost having a number of accreted trauma stories that they're carrying from so much service, and then their own individual and family losses as well. So with that, we talk about secondary trauma sometimes, about all the stories they carry. With that, probably a third of what I do is simply listening to colleagues and to what their stories are and all that, and just kind of you could say witnessing or empathy or that kind of debriefing, And we set up some explicit times like that, Palestine Red Crescent, for instance, and also just do that informally as comrades. So a main way that folks make it through with providing services like that in that different environment is caring for each other. There's a program in the Gaza Strip called Gaza Community Mental Health Program. Al-Barnamij Gaza li Sahab Nafsiya al-Mujtama'iyya, that's my poor Arabic. That is a 70 employee first mental health center in Gaza Strip that over the years has developed real good self-support within the agency with debriefings and so on. And also the seasoned staff there frequently support lesser trained folks from other organizations in kind of debriefing, if you will, and that. It's just flat out difficult. How do you spend time with a kid? In many different particular ways. Sometimes, like I say, drawing things out, or just flat out play therapy with blocks, and especially in the strip with some little guns and war items and things like that. Trying to let a child express themselves. Some of the kids there have been mute for some time after some of the major attacks, but express themselves in other ways, and of course gradually try to bring things more to a word level, and then sometimes bring in family and kind of dissipate, you could say, the tensions. It's also true that in an area like the Gaza Strip that's been besieged for, about a dozen years, and of course since the 1940s, just huge numbers of refugees, that the violence just kind of seeps through society in a lot of different ways. Within families, sometimes conflicts between families, number of different things like that. So it just kind of like permeates the society. So working in a lot of different ways can be really important in terms of even community and family mediation and so on. So
I'm going to ask a very hard question, and by no way do I am trying to insult or, diminish anybody's struggles. But I know there's this question, and this is a viewpoint that some people have. That area has been under so much trauma and so much violence. Is there hope for those people? Can they be law-abiding, calm, trustworthy people in the end with so much as a community that they have been through? Because I have heard this comment made several times of, when a community goes through that much for years and almost, 2 generations, you could say, it's how can those people be, productive citizens in the future? Are they to be feared, or is only a few portion of that community, supposedly, lack for a better word, have a chance of being saved or have a chance of living a, what we consider a normal, productive life?
Yeah. Like you say, you hear a lot of comments about that, and I think sometimes with a dehumanizing edge, or some people due to ongoing trauma just kind of lost. And especially with the real intense political and ethnic themes in the Eastern Mediterranean, certainly sometimes discussion themes like that can be used to maybe inadvertently or sometimes with a little bit more edge to them to kind of dismiss people. There's no doubt that in my experience in the Eastern Mediterranean, that the whole region has some degree of trauma. Yes, there are entrenched problems. To deny that would be foolhardy. But the region is full of just wonderful people as well. When I'm in particularly difficult areas, in some of the refugee camps in Gaza, I have hope there. I get that hope from seeing kids smile, seeing kids play, saying they want a future. Adults talk about what they'd like in terms of employment, in terms of some housing that's not in shambles and so on. A lot of discouragement, but yeah, there's full human hope. And I think one of the most challenging things is living with that hope and then having it so constantly and intensely dashed, including thousands of people lost in 2014 and so on. So it is true that there has been an increase, I'd say, in loss of hope, especially in young people, especially in teenagers, including some suicides, people trying to escape by swimming out into the sea, maybe drowning on purpose that way, and so on. So yes, some people lose hope, and encouraging that's a big part of the work. But I see a vibrant people specifically there, and Palestinians in the region and other people there. So certainly, it's just that it's under acknowledged and under supported.
I think that's a testament to human hope.
Absolutely.
And
Absolutely.
the fact that we always are looking for hope. Can you tell us a little bit about your work nationally, not just overseas?
Yeah, good. Let's talk about that. I think of each of us with our certain position, what can we best do? When I was younger, I wanted to learn Arabic and work more in that area. Didn't do that for different reasons, but now I say, well, I can do plenty kind of bridging. We do have a nonprofit in the U.S., Gaza Mental Health Foundation, where we take donations and work with partner organizations in the Strip, mostly the Mental Health Center I mentioned, and some women's groups there. And there are many other good organizations in the U.S. that are sending volunteers, that are bringing folks over here to give speaking tours, a lot of things along those lines. So if anybody's interested in any aspect, there's always many input routes. Some of the well-known ones, other well-known organizations, there's United Palestinian Appeal, there is Grassroots International, another U.S. group that gives into Gaza. Palestine Children Relief Fund does excellent work around that area, primarily general physical health, a little bit of mental health, things like that. But I think part of it, Asma, and this is how you and I met, kind of, is I think of just thinking of what are the underpinnings to the intense negativities in that area that are spilling out globally now, we could say, obviously. Right. So one thing I've been interested in doing is about Muslim communities in the U.S. and just thinking of health access, mental health, and so on. I'll say just in the last 5 years or so, my view is in the U.S. there's been a tremendous uptick in Muslim communities with kind of self-care activities. A lot of emphasis on mental health, a lot of the masajid having Friday's khutbah on self-care topics and so on. A lot more linkage between mosque communities and Muslims who don't go to mosque so much, and healthcare. A lot of things along those lines. You and I first met in, I think, even more broadly. So how to have the most vibrant, pluralist society here, bring everybody in and learn from all traditions. So I think about Islam in America and how to support each other. I'm not Muslim myself, but how to support kind of vibrant and assertive Muslim participation in the U.S. There's Muslim Caucus is an organization where I met Asma a little bit with a conference down in D.C. that had presidential candidates come and talk as a real wonderful example of excellent back and forth. I'd say one exciting thing recently has been the uptick in the last 10 or 20 years in a number of Palestine advocacy organizations kind of working on general cultural and political and kind of anti-Islamophobia kind of actions. One, you mentioned Jewish Voice. One way I think of them is in terms of the Abrahamic spectrum. Yep. Jewish Voice for Peace has come on very strong with Jewish folks in the U.S. strongly focused on equality and making some changes there. Christian groups have been around for decades, but still strong, coming on. Churches for Middle East Peace. Most Christian denominations have an Israel-Palestine working group, concern group. Palestinian group, FOSNA, Friends of Sabeel North America, which is a Palestinian Christian group. And on the Muslim side, of course, American Muslim for Palestine is just a very strong organization, a large annual convention over Thanksgiving weekend, doing a lot of advocacy around the country, different state organizations, trying to develop one here in New England and so on. There's just been a tremendous amount of different organizations across ethnic lines usually with all the groups saying, yeah, you're not exactly of our ethnicity, but come on, let's make some equality and plurality together.
Right.
So just thinking real broadly about all the social context, yeah.
So why this particular issue? Why have you decided that this is where you want to concentrate?
So two things. First thing, growing up, I liked languages. Our high school had French and Spanish. Woohoo! I took those. Went to college, Arabic. I thought Arabic, I fell in love with the script. It looked beautiful. Most of the Arabic language teachers in the 70s in the US, at least in my experience, were refugees, mostly from Palestine, some from Syria at that time. So through that, and also broader Middle East studies, studying Jewish history in the area and so on, I just, like I say, got to know people who were working fine across the ethnic lines there and really believed in kind of decency in Israel-Palestine and kind of in opposition to current paradigms and structures there. So that was one part of it. And then kind of going into healthcare it just seemed natural to go into this area. And then especially, I was born and raised in the U.S. I served in the U.S. military. Think a lot of positives about the U.S. and also a lot of, very obviously strong negatives. So I think I do feel a particular responsibility for a general U.S. public to know more about and to really think, what do we really want in that area? What are our values? All created equal, we the people, values like that. How does that go with such a different situation that we've been really supporting so long over there? How can things be changed for decency, safety, equality of all people? So things along those lines.
Do you face challenges when you go visit Israel to do this work?
In what? Say more.
Do you face challenges? And if you do, what challenges do you face when you do go to do this work?
Well, basic challenge is just time and money, trying to find the time and get over there. It has become increasingly challenging to move around the area there. As I'll say till now, as Americans, and I'll touch wood as I say this, I've had some privilege that folks in the area generally don't have to go between different countries, or I'll say political compartments that aren't what's a country or not is a challenge in that area. But yeah, it can be hard to move from one country to another if they're at war, as Lebanon and Israel are at this point. And actually entry into the area, especially into the area from the Jordan River to the Mediterranean, Palestine and Israel, that's been increasingly a hard area to access, and then particularly the Gaza Strip. But for that particular part, one has to be deeply vetted by the Israeli officials there, and I continue to be, and they do let some healthcare folks in there, but that's always a challenge. And I think those are some of the main ones, yeah.
Okay. Would you be, is this where your concentration is, or are you thinking of, there are many other areas that need so much help,
yeah.
Areas that have endured trauma, yeah, that really need a lot of help when it comes to mental health, yeah, or is this something that you want to concentrate on in this area?
Yeah. Great question. All of us humans, we're all psychologists on some level, and all reading each other and care for each other all the time. I think it's important that where anyone is, to try to help there, and whatever we're drawn towards, whatever particular issues. So for me, I do my best to keep a primary focus on that area, mm-hmm, really because of my personal history, just stumbling into the personal relationships across the ethnicities there since the 70s, and now having invested time into getting to know a lot of people in the area. But also, again, primarily because of being in America and just with the responsibility I feel because
right,
of our root role there, and really how a lot of negative downsides that's had around the world. So how do we reverse that? I was asked one time when the kind of Western Sudan, Darfur area was having big challenges by someone who felt that focusing on Israel-Palestine showed that might show that I might be against one of the ethnic groups there. I just said, well, it's that as an American, just such responsibility in the Israel-Palestine area. I can understand why people are interested in Darfur, and now in so many different areas, Syria, Iraq, Yemen, the Rohingya, and China, and so many places. Here in the US, obviously. It just happens in my case that I see the Israel-Palestine area as central, and I'll keep focusing on that. Well, on the side, if I can do anything else, try to help there.
No, I think you touched upon a great part where I think I need to learn too, is to, you can't help everything, you got to concentrate on a few things, which I think that is what you're echoing. We only have a minute or so left. I know you wanted to share some information of if people wanted more information on this topic and some of the work that you do, and please share with us.
There's so many good groups, you can't go wrong helping in any way. I did mention our group in the US, a 501c3 nonprofit, Gaza Mental Health Foundation. We're happy to give more information. We're on the web, you can Google us. There is a field guide kind of to activism regarding grassroots activism about equality and social justice in Palestine, Israel. There's a website, equalrespectforward.net, if you have any interest in that, equalrespectforward.net. Thanks, Asima.
Thank you so much. So we only have like a minute or so left, and usually at this time I share my perspective in a few words. Not of wisdom, but just my perspective. I don't think it's much wisdom. But you know, what we heard today is, again, a issue that we've heard in many different forms, in many different ways, pros and people who are against it. But in the end, whatever is happening, whichever side you're on, we cannot deny that there is a lot of trauma in that area, and that mental health is a necessity in that area, and we can't ignore it. So please, if you'd like, please spread the word, support some of these organizations. I know in this country, at least, we have started paying attention to this problem and really encouraging, as Dr. Bill Slaughter said, that we are encouraging a lot of people who do, suffer from trauma to get help. But there are people in the other parts of the world that don't have this luxury. And so what I believe is, when we share with others, we get more back, and which I think is what the motive of this show is, and what the point of this show has really brought is, the moral of the story is, the more you give, the more you get back. So thank you for joining us, and I hope you join us again on another Perspective show.